Okay, for the treatment of diabetes, you still go up to the SchrDbb algorithm. You start with the treating the disease, you relieve the symptom by treating the mechanism of the disease. Yeah, basically, you treat the cause of the disease, you treat the or you prevent and treat complication, you treat the background and treat the prognosis with the follow-up. So, how do you treat? Exactly. So now in the treatment, we start with the first two elements. The first element is treating the mechanism of the disease. To treat the mechanism of the disease, we use the principle of management. Exactly. We use the principle of management. Now, what is the principle of management here? Exactly. So that's the first goal. So the goal of investigation, you treat the mechanism of disease. You treat the mechanism of disease by using the principle of management. The second goal of treatment is going to be treating the cause. Exactly. The third goal is treat the complication. Treat the complication. Exactly. The fourth goal is prevent or treat the complication. The fourth goal is prevent reoccurrence. Is prevent reoccurrence by treating the background. And the fifth goal is a follow-up. So those are the different elements that you have to put up when the goals that you have to put for the treatment of all rare diseases. Is it clear? So you treat the mechanism of the disease, you relieve the symptom by treating the mechanism of disease by using the principle of management. And all this all these other ones treat the cause, prevent or treat complication, prevent your cause by treating the background and the follow-up. We now use all these other ones except the follow-up. We now use the means of treatment. The means of treatment can be pharmacological, it can be general, or it can be interventional. Is it clear? So those are the different means. Interventional can be surgical or radiologic intervention. Pharmacological is medical management, and general are the general means that you use. Is it clear? General. So those are the different means that you use for the treatment. So the first thing is what is the principle of management? The first question now you have to ask is the principle of management in case of hyperglycemic crisis. Is it clear? So, a principle of management in case of hyperglycemic crisis. So, when a patient has hyperglycemic crisis, the principle of management, the first principle is one, control the hyperglycemia. Is it clear? Control hyperglycemia. Is it clear? That's the first principle of management. Two, the second principle of management after that is fluid rehydration. Fluid rehydration. Is it clear? And then three, it is control potassium ion level. Potassium ion level and potassium ion replacement. Is it clear? So those are the different things that you have to put in mind. Now, you need to put in mind that what? So when you have this like that, so control hyperglycemia, fluid rehydration, potassium and potassium ion replacement, is it clear? So those are the different things that you have in mind. Now you need to know that what when you control the hyperglycemia, so you need to know that even fluid rehydration alone can be enabling, provided you're in a setting where you don't have even insulin to give. Just give fluid rehydration. We start with the fluid rehydration because that is very important. Is it clear? Because fluid rehydration alone can change the Glasgow of the patient from 8 and the patient goes even to 11 or 12. Is it clear? So we start with the fluid rehydration. So in case where the patient has a fluid, when you have seen even when you have diagnosed if it is hyperglycemic crisis, you need to do fluid rehydration. Now in the case of diabetic ketoacidosis, you need to rehydrate the patient 2 to 3 liters. So you need to rehydrate the patient 1 to 3 liters within the first 2 to 3 hours. Is it clear? Is it clear? So you rehydrate the patient 1 to 3 liters within the first 3 to 4 hours. Sorry. So rehydrate the patient 1 to 3 liters within the first 3 to 4 hours. And in the case of honk, you rehydrate the patient 4 to 6 liters within the first 3 to 4 hours. So when you're in the first 3 to 4 hours, when for your diabetic ketoacidosis 1 to 3 liters within the first 3 to 4 hours, while in honk is 4 to 6 liters within the first 3 to 4 hours. So within the first 3 to 4 hours, you have to give that to the patients. So for diabetic ketoacidosis and for honk. Is it clear? You rehydrate as such the patient. Now, so after the fluid rehydration, you now continue now with the next one. So that is for fluid rehydration, and in all for 24 hours. When you're in 24 hours, the patient that has diabetic ketoacidosis after 24 hours should receive 4 to 6 liters of fluid. While the patient that has the HONC, diabetic hyperosmolar non-ketotic state, have to receive in 24 hours 6 to 9 liters of fluid, even if it is per dose or how. Is it clear? You have to, even if it's you add oral hydration and all that. So those are the different fluids that you have to give to the patient for the fluid rehydration. Now, after the fluid rehydration, you now need to control the glucose level to control hyperglycemia. Is it clear? To control the hyperglycemia, you use now the ATRAPID protocol. Is it clear? ATRAPID protocol. Is it clear? Rapid insulin. So you use the ATRAPID protocol. To use the ATRAPID protocol, it is 0.3 international unit per is 0.1 to the international unit per kilogram to 0.3 international unit per kilogram per hour. Is it clear? So you use ATRAPID protocol is 0.1 to 0.3 international unit per kilogram per hour. Meaning that what? Meaning that in the first hour you can start with 0. You can either decide to start with 0.1 international unit per kilogram or 0.3 international unit per kilogram. Generally, it's preferred to start with 0.1 international unit per kilogram before assessing the next hour. If there is no decrease, you now go to 0.2 international unit per kilogram. You assess for the next hour. If there is no decrease before you go to 0.3 international unit per kilogram. So you modify the 0.1 to 0.3 based on the evaluation after the next hour. Is it clear? So that is how you modify the ATRAPID protocol. So that's how you control the hyperglycemia. Is it clear? Now you have to make sure that every time that you are low than 250 milligram per deciliter, you don't give again ATRAPID. You stop ATRAPID. Is it clear? When you are less than or equals to 250 milligram per deciliter, you stop ATRAPID or fast acting insulin. Is it clear? Now you give the lente insulin. Is it clear? You now give the lente insulin.